following is a production of West Virginia Public Broadcasting.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University. Welcome to Doctors on Call. Tonight's topic, hand, arm, and shoulder problems. Two experts are here to answer your questions. Now here's your host, Dr. John Phillips.
Good evening. Whether you feel a twinge of pain every now and then during certain activities, or a chronic pain that affects movement and your everyday life, hand, arm, and shoulder problems can be frustrating. It may be a problem with your nerves, as in carpal tunnel, or with tendons in tennis elbow, or permanent joint damage from arthritis or injury. When should you see a doctor? What surgical options are available for you? What do you do to prevent further injuries to your hands, arms, and shoulders? We'll get answers to those questions and more tonight from our two guests, Dr. Barry McDonough, an orthopedic surgeon and sports medicine specialist at West Virginia University, and Dr. Matthew Lose, a general surgeon at WVU who specializes in hand surgery. If you'd like to ask our guests a question, give us a call. Our phone lines are now open. Barry, we're going to start with you. What sorts of issues can occur with our joints and bones?
Well, joints in general are extremely complex, and especially in the upper extremity, you can have significant loss of range of motion as a result of an injury and or a dislocation of the joint. You can have issues with the tendons, such as tendinitis, or even a tear, such as a rotator cuff tear, and oftentimes you can also develop arthritis, which can be quite disabling.
Very good. Well, obviously our hands are very important to us, Matthew. What sorts of injuries can occur there?
Well, multiple injuries, just as Barry touched on. The hand in a microcosm is a very dynamic process. If you think about all the things that we do with our hands every day and how we abuse and ignore them on most occasions, it's very easy to suffer injuries not only related to arthritis, but also related to work-related injuries and other problems with tendinitis, those sorts of things.
Sure, and then Barry, our shoulders are important as well.
They certainly are. Most laboring, especially heavy laboring, involves movement around the shoulder, so any type of lifting, carrying, or pushing and pulling involves motion with the shoulder, and just to have a small injury there can often cause quite a disabling process to occur.
And you don't have to be an athlete to have a dislocated shoulder.
You certainly don't. That can happen as a result of such things as a car accident or even just a slip and fall.
Really? What about the hand and the arm? Same sort of issues there?
Oh, absolutely. You know, the problems with rotator cuff are certainly wear and tear, as Barry just mentioned. But within the hand, you can have injuries related to sports activities. Certainly skiing, we see a lot of injuries with ski accidents. Certainly injuries playing rugby, playing baseball, you know, those sorts of things. Anything where the hand really receives an impact or could get an impact, you certainly can see significant injury.
And we're all using computers these days.
And we're all using computers, absolutely. The repetitive motion is something that we certainly suspect is a strong component in not only injuring the tendons, but also causing some of the complex symptomatology of things like carpal tunnel syndrome, for example.
Well, I tell you what, let's get back to carpal tunnel. We'll get into some specifics now. I want to talk about the rotator cuff. What is the rotator cuff? Tell our audience why it's important.
The rotator cuff is made up of 4 separate tendons within the shoulder, and this basically helps in elevation of the shoulder and doing any type of overhead lifting. Oftentimes as we age, it becomes easier to kind of cause wear and tear on that, and over time you can develop a tear through and through the rotator cuff. And this can often cause weakness as well as cause significant pain and discomfort in the shoulder.
Okay, great. We want to get to some of the therapies to prevent that, but we already have our first caller. We have Dixie from Marshall County. Dixie, welcome to Doctors on Call.
Thank you.
You have a question?
Yes. I crushed my elbow about 13 months ago, and had some surgery on it there at Allegheny General Hospital in Pittsburgh, and had fixators put on it. And my elbow is still very loose, very painful, and the doctor is talking about an elbow replacement. I know I'm very young. I'm 57 years old, and they don't like to do it when you're that young. I was just wanting to know a little bit more about the procedure as far as the elbow replacement and the likelihood that that would work and take my pain away.
Okay, great question. So Dixie has an elbow injury at 57. Still having problems. What sorts of things may you recommend?
You know, elbows are an extremely difficult joint. They seem fairly simple, or the elbow seems fairly simple when you think about it. It is mostly a hinge type joint, but it is pretty resistant to any derangement of its stabilizing forces, the ligaments and such within. And so rehabilitation and repair of elbow injuries, especially a crush type injury, can be quite difficult. The process of perhaps going through joint replacement and those sorts of things certainly can perhaps lead to a relief of pain, but there are also other associated complications that she really should talk with her physician, her surgeon up there, to make sure that she's doing the right thing for her and her lifestyle particularly.
So what are the indications to replace it versus just doing physical therapy or other means?
Well, certainly indications for replacement would be pain, would be arthritis or degeneration of the joint, would be instability of the joint. The other indications that we often look at for any type of joint replacement is the demand that the joint would require, that the patient requires. Sure. And so in somebody who is active person who perhaps does a lot of heavy lifting or a lot of heavy labor, joint replacement unfortunately doesn't offer a lot of long-term rugged stability. It's really more for folks who use their limbs, their arms, their hands in more routine day-to-day activities as opposed to really vigorous type activities.
Very good. Well, Dixie, good luck with that. We have our next caller. We have Karen from Jefferson County, Ohio. Karen, welcome to Doctors on Call.
Thank you.
What's your question?
I was diagnosed last February with frozen shoulder, and I'm still having a lot of pain with it and very limited mobility. I just wondered if that's common for it to go on that long.
Actually, it is. Frozen shoulder, otherwise known as adhesive capsulitis, is extremely problematic, especially in patients that have a history of diabetes as well. And it isn't unusual for patients to have problems for up to 12 to 18 months from the initial diagnosis. It usually goes through a few stages where the first several months are often quite painful, and your range of motion maybe not limited as much as you would think, but as time goes on, usually your motion decreases and your pain improves. But again, with an aggressive physical therapy program working on maintaining your range of motion, regaining some of that loss in motion, it usually does come back about 12 to 18 months from the initial diagnosis. But oftentimes a manipulation as well as sometimes an arthroscopy of the shoulder can be beneficial. I usually like to wait at least 6 months before offering that to patients though.
Are there anything else, is there anything else that people can do to prevent these sorts of complications?
Oftentimes just staying active and utilizing the upper extremity and using the arm and shoulder itself will help to keep this from occurring.
Okay, great. Our next caller is Marcy from Fayette County, Pennsylvania. Marcy, welcome to Doctors on Call. Do you have a question?
Yes, I had carpal tunnel surgery last December, and since I had it done, my thumb does not work right. It will not bend all the way into my hand. And every so often, whenever I go to open up a door or clench a fist, my middle finger will stay stuck, and then I have to push it with the other fingers to release. I don't know if it's a result of the surgery or if it is something that happened afterward.
Okay. So Marcy's been about 10 months out from her carpal tunnel surgery. Still having some difficulties?
You know, and the number of complications or issues that you raise may be related to the carpal tunnel surgery, may not be. I think that that's something that really should be evaluated more closely before making any judgments here. The interesting aspect that you bring up is the inability to straighten the middle finger when you try to make a fist. That is less likely to be related to the carpal tunnel syndrome, more likely to be related to a problem with a tendon involved in flexion of that middle finger, which certainly can occur at any time and almost in any finger. So again, something that I think that both issues should be something that should get looked at, for sure.
So have a doctor look at it again. Is it common? How long does it usually take to recover from carpal tunnel surgery?
There are two major types of carpal tunnel surgery. There is a traditional open type of surgery, and then there's an endoscopic carpal tunnel surgery. And there are pluses and minuses to both. The typical recovery time that I quote folks is about 6 to 8 weeks. Folks who are in heavier demand jobs, folks who really use their hands, for example, mechanics or construction workers, those sorts of things, probably want to baby their hands a little bit longer than folks who, are more sedentary, office work, those sorts of things. But it definitely, carpal tunnel, just like any other surgery, you have scar tissue you need to worry about. The therapy program is certainly important, and clear outlining of the goals of the surgery before you go through the surgery are important.
Good, good. Well, Marcy, good luck with that. Our next caller is Stanley from Jackson County. Stanley?
Yes, doctor.
Welcome to Doctors on Call.
Yeah, I have an impression of my MRI. It says I have a focal full thickness tear of the anterior superincus tendon and a partial undersurface tear of the superincus tendon more posteriorly.
Mm-hmm. Okay.
Of course, I don't know how serious this is. I just picked up my MRI report today.
So that's
I've been in considerable pain.
That's an MRI of your shoulder?
Yes.
Okay, very good. Well, these guys knew what you were talking about, I hope.
Sure. It sounds like he has a small full thickness tear involving the most anterior, the front portion of the rotator cuff. And this is fairly common, especially again as we age. That area is under significant demands and has very little blood flow and ability to heal. So oftentimes it can develop a tear in that area. Usually in those types of patients that present with those MRI findings, I would normally start with not only a history and physical, but offer them possibly a corticosteroid injection into the shoulder to hopefully ease their pain, as well as get them into a physical therapy program to improve their motion as well as decrease their pain and increase their strength. If that fails, then I think discussion about surgery is warranted.
Okay, excellent. Very good. Our next caller is Paul from Ohio County. Paul, welcome to Doctors on Call.
Hello.
Hi, what's your question?
All right, my question is, I'm 57. I hurt my shoulder, I torn the rotator cuff, my left shoulder, and I didn't file a compensation claim. My job's physical. And I was wondering, since it's been like 7, 8 years, and it cracks and pops and everything else, if I did have surgery on it, how long would it take, or is it screwed up too much for surgery, or is there like arthroscopic surgery or anything like that? Because I've been living with pain for a good while.
That's a great question. A lot of us injure ourselves and we just put it off. So is 7 years too late for Paul to do something about his shoulder?
Certainly, I wouldn't think that it would be, but a lot of factors go into that decision. I think one of the biggest factors is actually the size of the tear. In our previous callers, we've had patients that sounded like they had a small tear of the rotator cuff, and these oftentimes will do quite well and have a good healing potential. When you start to get really large tears, especially tears that end up becoming retracted or pulled back, those tears oftentimes don't do quite as well because it's more difficult to get that tissue back out to the place where it needs to heal. And they have a higher rate of re-tear as well as a higher rate of failure after surgery. Arthroscopic surgery is a good option, especially to evaluate the size and the shape of the tear, and oftentimes you can fix those through the arthroscope as well. But even that being said, you can use a small incision often to fix it.
Okay, so MRI, is that the modality of choice usually looking at these sorts of problems?
I think it is.
Yeah.
After a good quality history and physical exam, I usually will get x-rays on the shoulder to make sure that there's nothing else that could explain, such as arthritis, that could explain the pain or discomfort that they're having. And oftentimes then, if they have significant weakness regarding the rotator cuff, I will obtain an MRI.
Okay, very good. Our next caller is Donna from Lawrence County, Ohio. Donna, welcome to Doctors on Call.
Hi.
Good evening. Do you have a question?
Yes, I do. I have a trigger thumb. I just wonder if there's any rehabilitation for that.
Okay, Matthew, a trigger thumb. What is a trigger thumb?
Well, that's an excellent question. It's very common. Trigger thumb is basically a swelling of the tendon involved in flexing your thumb. And as that tendon normally glides through a tunnel, that helps to keep it close to the multiple bones in your thumb and all the other fingers. It can swell, and as it swells, it gets stuck, basically. Is there specific therapy for it? Usually not. There are interventions, I should say, that we can do for trigger thumbs or trigger fingers in general that can significantly improve the pain that you're feeling and the locking sensation that you get. And then they don't have to necessarily be surgery. So I think that it's certainly something to have checked out and talk to somebody about.
What about prevention?
Prevention of trigger thumb?
Yeah, before you even, is there something that she may have been doing that?
No, unfortunately, there's really nothing you can do to prevent trigger thumb. A lot of people live with minor swellings in the tendons of their hands just because of overuse. And at some point, the swelling gets to a level or a extent that it starts to interfere with the normal glide in its normal functioning.
Okay, very good. I think I have this right. Our next caller is Dreama, and I believe it's from Fayette County, Raleigh County. Dreama?
Yes.
Welcome to Doctors on Call.
Yes.
Can we have your question?
My question is, I've had carpal tunnel surgery twice in the right hand, once in the left. The scars, and it was the open method, not the orthoscopic, but the scar in the left hand from pretty much right after surgery, I can't run my finger over that scar or certain things touch it. It's like 110 volts of electricity goes through. And I'm wondering, is there anything can be done with that?
So specifically, it's the scar that's bothering you, not the...
Well, the carpal tunnel actually pretty much is back, like the fingers and the tingling, but the scar really bothers me if I just brush something up against it or try to run my finger over the scar. It's like 110 volts of electricity goes through.
And how recently was your last surgery?
Well, this one was done several years ago, and they had sent me to WVU to check and see, to a doctor there, to see if the carpal tunnel could be done again, but they said it was a 50-50 chance that it would, make it worse. So I opted to leave it alone, but I'd like to see if there was anything could be done with that scar.
You raise a very difficult question, and there's this, it's a hyperesthesia, basically, that can develop in scar tissue anywhere in the body. And unfortunately, in the palm, because of the active nature of the use of the hands and just the fact that every time you grip something, and just as you described, when you open a car door, when you open a door around the house, you're rubbing up against that scar. Is there something that can be done? Perhaps. Is it going to be something that someone could guarantee, I can make it better if I were to, for example, re-excise the scar or somehow change the scar? I don't know. It would be one of those things where we would have to, perhaps have you evaluated, those sorts of things. And I know you've already been through that several times, it sounds like. I don't know that there's an easy answer for you. There's, it sounds like a very complex pain syndrome that you may be going through. And it may be better served by someone who perhaps deals in pain syndromes as opposed to simple scar re-excision or exploration.
Okay, well, sounds really difficult. Good luck with that, Dreama. Our next call is Jean from Cabell County.
Yes. Hi.
Hi.
Thank you for taking my call.
Thanks for calling.
I have recently had an MRI of my right shoulder, which showed an impingement syndrome, 2 incidental cysts near the head of the humerus, and some arthritis. Years ago, my shoulder took a lot of punishment from athletics. My question is there anything that can be done to actually get the impingement syndrome to improve that? And I might add, I also have fibromyalgia. So,
Sure. Sure. The term impingement syndrome basically refers to tendinitis of the rotator cuff. And the way we go about treating that, again, is with getting patients into a physical therapy program to work not only on range of motion exercises, but strengthening exercises of the shoulder. That, coupled oftentimes with injection of a corticosteroid and local anesthetic, will often relieve their symptoms in regards to the pain. The small cyst that she was describing most likely is related to arthritis of the shoulder as well. And the use of an anti-inflammatory like ibuprofen or Aleve oftentimes will help with those symptoms.
Okay. Well, while we're on the topic, because we have the same recurring theme, is there anything that we could be doing as athletes, as younger people, to prevent some of these injuries as we get older? What about diet? What about vitamins? Exercise, I mean, obviously.
Right. I don't know of any studies out there that have looked at the use of supplements to help with specifically the rotator cuff in regards to decreasing the risk of tear or developing tendinitis. But especially in athletics, using good mechanics, whether or not you're a throwing athlete, as well as keeping not only your shoulder and arm strong, but also working on core strengthening, is certainly ways to help lessen the problem and the problems of having an injury of the shoulder.
And I would just add to that, proper pre-game stretching, warm-up, et cetera, as in addition to post-game, letting your body cool down can be very important. And proper mechanics, absolutely.
Yep.
Very good. Well, our next caller is Tim from Mingo County. Tim, welcome to Doctors on Call.
Thank you for having me.
Thanks for calling. Do you have a question?
Yes, I had recently had an accident, a car accident, and it was pretty severe. My left arm was crushed, and they had to put steel plates in both sides of it, and it affected my nerves in that arm. Okay. They just done an MRI of my right shoulder, which they didn't do in the trauma unit, and it showed I had a bunch of things wrong with my right shoulder, and they done an MRI of it, and it showed, from what I could understand, that the cartilage was torn and tore, that it was tore and it was bunched up, and there was a tear in the rotator cuff, small tear. Okay. And he don't really know whether he wants me to have surgery, but I have Medicaid, and I'm in a tremendous amount of pain, and I don't know how long it takes Medicaid to pass an operation. But like I said, I'm in a tremendous amount of pain from it. I received a crushed jaw and a cracked skull. They had to take the water off my blood off my brain, and it was a really terrible accident. And I broke 2 vertebrae in my back and 4 ribs in the accident also.
Wow. Okay. Well.
Which I'm dealing with a whole lot of pain.
Okay.
But about the shoulder.
Sure. Okay. So.
He's saying that I need an operation on my shoulder.
Okay.
To remove the busted cartilage that was there,
okay,
or something that was rubbing up against something else that was causing me a tremendous amount of pain.
Okay. So we have about 1 minute for you to see if we could do anything for Tim's pain while he's waiting for surgery.
Well, maybe I'll address the nerve issue and refer the shoulder back to you.
Sure.
First of all, thank goodness you're sitting here talking to us. The nerve injuries are very common in upper extremity injuries such as you're describing. And typically what we try to do is allow the body to enough time to heal in order to see how the final injuries from any nerve injury may play out. And then at that point, proceed with any type of a plan for reconstructing or reconfiguring the extremity to work perhaps a little bit better.
Yeah.
Okay.
In regards specifically to the shoulder, once a good history physical exam have been done to make sure that the pain in fact is coming from the shoulder, because there's a lot of different factors with that last patient that could be contributing to some of this pain. I think it would be worthwhile after failed non-operative treatment with physical therapy, injections, and anti-inflammatories to consider an arthroscopy of the shoulder to look at the inside of the shoulder and see if in fact there could be anything that could lessen his symptoms.
Okay, so boy, he's got that. That's a really complex patient, right?
It is.
So in our last 20 seconds here, we had to think. He needs to think about his joints, his nerves, his back, and of course his brain as well, and they all work together to cause problems.
Absolutely.
Okay. Well, we wish you the best of luck, Tim. Today's been a great conversation with lots of great questions. We've been talking about hands, arms, and shoulders with Dr. Barry McDonough and Dr. Matthew Louse. Lose. Thank you both for being with us. If you'd like more information, see your family doctor or visit our website at wvuhealth.com. For Doctors on Call, I'm Dr. John Phillips. Good night and good health.
Join us again next week for another edition of Doctors on Call. Our topic will be heart problems. Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.